Then we have what? Sublingual. Sublingual.
Do we have these PowerPoints?
I will print it out for you later. Beneath the tongue, yes? Beneath the tongue. It's called sublingual. Okay. Sorry. This should be. Then, when you give medications into the muscles, how do you call that? Huh? If you give medication in the muscles, it's called intramuscular. IM. Intramuscular, that is into the muscles. Drugs, vitamins, for example, can be given. If you give subcutaneously, it's called what? For example, subcute. Okay, it's called in the what? Or beneath the skin. The skin in the fat tissue, okay? And when you give into the skin, it's called what? Intradermal. Okay, there are also others which are called transdermal. Because there are some transdermal patches. Basically it's in the skin, but just the way it's being given is different. So these are what we call the routes of medications. So always when you are giving medication to patients, you have to check some rights of what? Medications. What are these rights? Do you know that? One, you have to check the right patient, yes? Okay, the right what? Medication. Yes?
Right dose.
Right dose. And what? Right?
Time.
Yes, time. And right? Route. The right route. And the right to refuse. Patients have the right to refuse. Right to document. Okay. So you have to check if it is the right medication, okay? Okay, you have to see the drug. So how many times should you check if it is the right medication? 3 times. Okay, how is that?
When you take the medicine.
When you take the medicine from the cabinet,
When you start the feeding,
when you prepare,
and
when you are giving. So 3 times you have to check if the medication is correct. And check with the patient, the right patient, okay? It's very, very important. Sometimes you might give to another patient another medication. Yeah, I had recently a nurse told me they switch medications and yeah.
If sometimes we happen this thing, so what we do?
The first thing you pray. Let's say, for example, I know, for example, it's a long time, a student nurse, she changed the route. The drug that's given IM, she gave it IV. And the patient died. Yeah. So that is really very important. It's not, it's just not like a joke. Okay. Last time when I had my flu shot, okay, she get inside and the needle like bread from the and then it's leaking. Because I know that, just I was calm and then and then she has to take off everything and she changed it everything.
Oh my God.
Actually, the medication was correct, but you look here, the stuff was not.
It wasn't really her fault, right?
Yeah, it's from the company when it's come when the producer. Okay.
You say write some medication, write up documentation. Who's documenting it? Me?
You are the one. Yeah.
Yeah.
You have to document properly, because once you are writing on a medical record, what does it mean? It's a legal document. Okay, a medical record. Okay, once you start writing the patient's name, it's starting to be what? A medical document. From that time onwards, it's a legal document. It means for any legal reason, if this is wanted, that's what is going to be seen. Whatever that you don't write it here, I can't. Okay. Let's say you don't document it there, but you gave it. Okay, and let's say the patient said I didn't give me. So how do I know? It's not there.
Yeah. So it's good not to write.
Yeah?
Each and every time you documentation.
Yes, always documentation. What is right to refuse?
But most of the time we're gonna be checking, like we're gonna be given documentation, and we just verify that, right?
How?
Like if we're told, to draw the blood and if
Yeah.
they're fasting or not,
Usually
then check the chart.
there is a medication chart and so on where you feel. Or usually now you put it on the electronic medical record. Okay, you document it there. But if you don't document it, then no one knows that you gave it or you didn't give it. If you say, oh, I gave it, but okay, how do the doctor know or how do the other know? Okay, that's very important. The right to refuse is the patients have the right to refuse taking medication. So you have to accept that.
Yeah.
Hmm? Yeah. Okay. So now there are lists of here medications. Let's see them. So I think the best thing here is if you can make like a flash card, so that you can easily study those medications. For example, you can say analgesics. Okay, so which are the analgesics? You write them here on the back of that. You write it like that. Okay. So what you do will be, if you go here, okay. So let's say you are right what analgesics. Analgesics, yes. So that does. So now you write this one. Write lower down here. So what are some of the examples for analgesic? For example, codeine. Okay, Vicodin. Okay, hydrocodone. Okay, oxycodone. Okay, naproxen. Okay, Darvon. Aspirin. Tylenol. Morphine. Methadone. Okay, so now these are the medications: codeine, Vicodin, hydrocodone, oxycodone, naproxen. Okay, then what you do will be you print out this one. Now what did you create? Or you can split the, okay, so that means you bend this one here, so that means that will be your flash card, yes? Yes? Yes. So now analgesics, what are they? Codeine, Vicodin, hydrocodone, oxycodone, naproxen, okay? Then you go for that. Okay, anti-anxiety drugs, you go for that. I think that is the easiest way of studying medications, is to make or or if you want, there are to be sell on sale. How do you call this? Flashcards, medication flashcards. You can find them in bookstore or something like that. Yeah, but I think you can make it. Just there are some easy few only. This one and the next page here. Just you make them like flashcards, and you can easily. If you know this medication, that's enough. I remember one student. She got the job, and then when she got the first day, what they told her was about the medications. About medication, they give her prescription, and then but I think she don't know what to do with that, or even the medication. So it's very important to know that. And then she came back and she told me that she stopped working. Why? Because I don't know those medications. I mean, she's frustrated with the medications. So at least knowing these ones will be enough. If you know these ones, okay. If you know these ones, at least that's enough. I mean, there are lots of medications, but knowing these ones will be enough. Okay. So let's get knowing these ones. Okay. These are some. Here are some routes like topical. When we say topical, what does it mean?
Top of the skin.
Always when we apply on the skin, it's called topical. Ointments, okay? Like ointments and there are what we call lozenges. Do you know lozenges? Lozenges. Okay. Okay, topical are what we call, you apply them where? On the skin.
Skin.
And inhalational, like when taking breath. On the eyes. Eardrops. And then through mucous membranes.
Yeah.
And enteral means when they get into the,
Swallow.
yes, when you swallow them.
Swallow.
These are called enteral. Okay, like what? Oral, buccal, sublingual, or enteral. Or if they have a GI feeding tube, or through the anus, for example, in case in children, you put, for example, for fever, okay, through the anus. That's also enteral. And parenteral means always when you give them,
Injection, like.
yeah, like IM, subcutaneous, intradermal, IV, all of these are what? Okay, and here also IV. Intra. Is there IA intraarterial? Can you give a drug in the arteries? There is also intraarterial route. You see, you can give also intraarterial some medications. Yeah, for example, for cancer treatment, like chemotherapies and so on, you can give them intraarterial.
But this type of the special nursing, no?
Yeah. That one is, yeah.
This is
Let's say, yeah, if you, it
This is
depends
not
on where you
common.
are working. Okay, usually you need to be skilled for that. Maybe, yeah. Skin is what? Intradermal.
Although there are a surprisingly high number of ways of getting drugs into your body called routes of entry, we're just going to talk about some of the most common. So one that might come to mind pretty easily when you think about maybe hardcore drugs is injection. So we'll talk about that. The other main routes are oral entry and inhalation. Oral entry means that you swallow something, so that could be a pill or some alcohol. Either way, you're eating or drinking it. You're ingesting it in some way. And this is one of the slowest routes of entry because it has to go through your gastrointestinal tract in order to get absorbed by your bloodstream, which can take about half an hour, give or take a few minutes. Inhalation, on the other hand, which is when you snort or smoke or breathe in the drugs, is actually much faster. Because once you inhale it, it pretty much goes straight to your brain. It can be there within 10 seconds. And then you start feeling the effects. So this would be, a lot of times, tobacco or cocaine is often snorted. And finally, the most direct route is injection. With injection, we're usually talking about intravenous injection, which means it goes right into a blood vein. This begins to take effect within seconds. Intravenous injection can be very dangerous because you're much more likely to inject bacteria or other unexpected toxins along with the drugs, especially if you're using unsterilized paraphernalia. So if someone else has used the needle before you, then this increases the likelihood you'll be exposed to something harmful, such as HIV. Okay, so those are the 3 most common routes of entry, and now I'm just going to mention 2 more that are moderately common: transdermal and intramuscular. Transdermal entry means that the drug is absorbed through the skin, and this is how patches like the nicotine patch, for example, works. The drug in the patch has to be pretty potent, and it can be released into the bloodstream over several hours. Intramuscular entry means that a needle is stuck directly into the muscle. So before we talked about intravenous injection, this is intramuscular. Depending on the chemical properties of the drug, this method can deliver the drugs to your system very quickly or more gradually. One example of a really quick entry for intramuscular injection is when an EpiPen is administered to someone experiencing a severe allergic reaction. So when people have such a reaction, their airways start to close up, so they need to get a dose of epinephrine into their body to open their airways as quickly as possible. And if you've ever seen or done this, the needle usually goes into a large muscle in your thigh, because studies have shown that to have the most access points to blood vessels, you need to stick it in that particular muscle. So the epinephrine can take effect really quickly. Many vaccines are also administered intramuscularly, which is why your arm gets sore after some shots, like the flu shot or something. And now I've been talking about how fast these different drugs take effect based on the route of entry, which may be clearly relevant in the case of the EpiPen when you're trying to save someone's life. But another important element connected to the rate of absorption is the potential to produce dependence. People are more likely to become dependent on drugs that take effect more quickly. For example, injected drugs have higher addictive potential than pills.
Okay. Now let's go to some of these medications here that are listed. Okay. So analgesics. As I told you, let's say if I ask you analgesic is what kind of medication, I give you.
Painkiller.
Yes, they are painkillers. Or, for example, they will ask you which of the following is an analgesic. Okay? So you see, knowing these ones will be, okay? So analgesics can be divided into 2 kinds. For one is non-narcotic, the second one is narcotic. Okay? So usually non-narcotics are for mild pain, when the pain is very small. For example, narcotic is morphine, for example, is narcotic. So you don't need to take it for it's easy pain. I have, let's say, headache, and I take more morphine, that makes me dependent. It's not good. Yes? There is a pain which is called intractable pain. Intractable pain. What's intractable pain? Sometimes they call it IP, intractable pain. Huh? This is pain that is not curable by any known means, and which causes a bed or housebound state. Okay, a pain that really you can't relieve it is called intractable, but it's very deep-rooted pain. Intractable means deep-rooted. Okay, so you give them anti-pain, narcotics, and so on. You can't relieve it. Okay, that kind of pain is called intractable pain. So usually that is a very serious pain. When some has like cancer and so on, bowel organ, intestine cancer and so on, they have that intractable pain. You can't relieve it by, okay? Let me okay. So what are these common medications here? So these are our common medications, so analgesics, okay? Okay, next, anti-anxiety drugs. What are these anti-anxiety drugs? Usually what do? They suppress anxiety. If you have anxiety, they suppress it, and they relax your muscles. Okay? They decrease what? The tension. Okay. So some examples are Zoloft, Lexapro, Effexor, like this. Antiarrhythmic drugs. Antiarrhythmics, what do you mean by arrhythmia?
For heart?
Yes.
Heart beats.
Yes. When you have, that's for heart. Arrhythmias means irregular heartbeat. When you have an irregular heartbeat, it's called arrhythmia. So because rhythm is a heartbeat, okay? So when the rhythm is regular, it's just a rhythm. It's a normal sinus rhythm when it's regular. When it's arrhythmia, the heartbeat is not under rhythmic control. That means the heartbeat is not coming under constant space. So when we say anti-arrhythmia or anti-arrhythmics, what does it mean? It means to control the rhythm. Okay? So what are they? These are what we call beta blockers. Okay, beta blockers are like what? Propranolol, for example, they didn't put propranolol here, but it's one of those. Acebutolol, okay, betaxolol, esomolol, nadolol. So all of them that end with olol are beta blockers, always. And there are also alpha blockers. These are beta blockers. There are also alpha blockers. All of them, they end up with olol. Okay.
A person with arrhythmia can take aspirin because aspirin makes the heart beat fast.
Aspirin usually is a blood thinner. It thins out the blood, and it's helpful for heart conditions. So usually they give it to decrease because it's a blood thinner too, so that you see the blood won't like clot in the vessels. So sodium channel blockers are like what?